back to that story. Let's go back to those breaking news. We mentioned that the Vice President of Zimbabwe has announced that Zimbabwe has now been placed back under full lockdown amid COVID-19 pandemic concerns. SABC correspondent Effort Musekiwa is in the capital, Harare. He joins us now to tell us more. So, Effort, tell us about this announcement. When exactly was it made?
Well, the announcement was made just about 30 minutes ago. The Vice President, like you did indicate, said that with immediate effect, all gatherings have been restricted to only 30 people and movement is restricted. Only essential services will be allowed to move for the next 30 days.
Effort, do we know what precipitated this?
Well, there's been a surge in the number of confirmed cases, and we've also seen hospitals not being able to cope. We are getting reports that in most hospitals, remember, Zimbabwe has got a poor healthcare system, and because of that, the surge in numbers has actually overwhelmed the hospitals that are actually operating at the moment, and it is one of the biggest causes that has led to this decision.
Effort, I did mention to the viewers that according to the latest figures, Zimbabwe has something in the region of just over 14,000, in fact 14,084 COVID-19 cases. Do we know just how much the exponential growth has been, if over the past 24 hours or maybe the past 7 days, just how much has been the surge I'm trying to gauge?
Okay, just before the Christmas break, the numbers were ranging below 100 per day. Now, for the last 2 days, we've had 300, we've had 274, and really it's been growing, and there's been, a steady growth in the numbers, and they are actually worried. The only figure, or the statistics that I have, is for the month of December, where they are calculating that 40% of the cases that we have all occurred, of the total number of cases only occurred in the month of December. So really the numbers are indeed going up.
And the already stressed health system that you're referring to, how does it work if somebody is in a very remote area and they're unable to access healthcare? Have there been emergency healthcare units that have been set up? Just how dire is the situation?
Well, let me start with the urban areas where if you suspect that you have COVID, the majority of people actually have to use private services where they pay between $60 and $100 just to get a COVID-19 test. The government institutions or free testing is not available. So the majority of these numbers that you are getting are actually coming from these private healthcare providers. Now, in the remote areas, government did say that they've actually intensified the testing, but we do not have any confirmation as to is the free testing available in those remote areas. It's not clear. We might have to follow up on it and find out if it's really true that they've actually intensified. But in terms of getting free testing, it's not available. People actually have to pay to get tested.
It's very interesting that you should say that, Effort, because in South Africa we're normally given the public and private healthcare figures. So does that possibly suggest that the figures in Zimbabwe, as in the official figures for COVID-19, could be much higher than we're told at the moment?
Indeed, the actual figures could be higher, and the hospitals, or one of the healthcare centers I passed through earlier in the afternoon, St. Ains in the capital, I actually saw a very, very long queue of people wanting to get tested. And this is a service where you actually have to pay. So in the government institutions, we do not know, we do not have an indication as to say how many people, but this sudden move actually tells you that the numbers have actually gone up, and no one was anticipating that we'll actually go into this level of lockdown so sudden. And I suspect that the numbers are actually high in the public health system.
Now, Effort, the Zimbabwean government has in its lockdown regulations also very strict entry and exit requirements, and that includes a PCR test. We've seen in South Africa people coming through from the Beitbridge border posts claiming to have done PCR tests, which have found to be fraudulent. Is it possible that the latest conditions and the impending lockdown measures have seen those people fleeing to South Africa and desperate enough to have fraudulent tests done?
Well, the economic situation in Zimbabwe and the high levels of corruption actually lead to some of these cases turning up where people actually connive with some of these healthcare officials to get fake certificates so that they can actually travel. So it is also very prevalent because of you understand the economic situation where people are desperate to make a living, to make ends meet, and in such an environment, it actually promotes that nature of doing things where people get and actually people supply fake certificates for people who want to travel, for people who want to access or want to go into other countries. But really, PCR tests are only done by a few institutions in Zimbabwe. Most of them are accredited internationally, but those of them, they do carry out proper testing. But most of the people that we have had that are traveling through the borders have actually had to go through some of these fraudulent means to get a COVID-19 certificate.
And this makes one then wonder, Effort, about the conditions for a majority of the people on the ground. $60 is quite a lot of money for a lot of people who don't have much. So for those people who can't afford, do they at least have access to personal protective equipment? Are they able to get some from the state or at least donors?
Well, the donors have been coming through and donating PPEs for the healthcare workers, but you also recall that the nurses only returned to work just less than a month ago. They've been actually on industrial action, citing lack of PPEs. The doctors, the same. They in the public sector, the doctors actually returned to work about 2 months now. So really it tells you that in the public sector, it is a dire situation. It is a desperate situation. PPEs are available, but they are not as readily available as the healthcare workers would prefer. And donors do come in and give here and there, but it's not enough to meet the requirements, especially when you're faced with a pandemic where PPEs become a priority.
Effort, inequality has been vastly exacerbated in South Africa and other countries, and I'd imagine the same in Zimbabwe. So if people are under lockdown and there generally is a shortage of basic resources, is there any wonder how people are going to survive if there's restriction of movement and it's very difficult to get access to food?
Well, it's going to be very interesting. Remember, initially, when the pandemic began, Zimbabwe instituted a 21-day lockdown, which they quickly relaxed so that people would access food, people would actually fend, and so that life becomes easier. Right now, they've announced a 30-day full lockdown. We don't know how this one is going to pan out. We don't know how people are going to survive. It's going to be very difficult for the majority. Remember, majority of the citizens in Zimbabwe are informal workers, and they live on a daily basis, on a hand-to-mouth basis. So having them locked down again is going to create more problems. It's going actually to create a dire situation humanitarianly.
At first, the full lockdown, the curfew was between 10 p.m. and 6 a.m. Are the conditions still the same?
Well, the health minister said that they will issue a statutory instrument on Monday to indicate the times of the curfew, but some of the measures come into effect with immediate effect. So we only know on Monday what time the curfew and other restrictions would, or what nature other restrictions will take once the statutory instrument is issued on Monday.
Doesn't that present a problem, though, if you don't know when the curfew begins and ends, as you say, and it's such an unfortunate thing that we lost him at that pivotal point, because it's, I'd imagine, going to be very difficult for people to know that they're officially under curfew at a certain hour if those hours have not been given by the government. As you said, my colleague Effort Musekiwa, that the Vice President, who's also the Health Minister, Constantine Chiwera, has said that that announcement is stationary statutory statement will be put out on Monday. So Zimbabwe officially back under full lockdown. Health systems there bearing the brunt of rising cases. Efforts saying that whereas before Christmas there was about 100 a day, the number of infections that has jumped to more than 300. Country sits at just over 14,000 COVID-19 cases at the moment.